All right, we'll go ahead and get started here. So this week, the challenge is about trauma and digestive issues. And they go together, and don't know if you've heard about it, but they've discovered and figured out that there's a gut-brain connection. And that connection, the super highway for that connection is the vagus nerve. It's the biggest nerve in the body, and it goes from the brain all the way to the digestive system. And the digestive system itself has has what they call a brain of its own, and it has its own nervous system that's within the digestive system. So within the intestines and the other digestive organs, there's a neuronal network that we've known about for a long time, but we didn't know about the connections. And they've discovered that that superhighway called the vagus nerve carries microbes, it carries cytokines, which are chemicals that communicate between the cells. It also carries neurotransmitters, both up and down from the brain to the gut. And yesterday, what we talked about basic symptoms of irritable bowel. And okay, Bama girl, you're asking, what GI digestive health tests do I recommend? So I usually get stool tests when people are complaining mainly of digestive symptoms. And there are many stool tests. There are many different companies that do them. Lately, I've been fascinated, or I get a lot out of Microbiome Labs has a test called Biome FX. But there are other tests also from other companies, and there are different reasons why I would order different ones. So it's not just one test that I use. So it just depends on what I'm trying, what I suspect most is for the diagnosis, or if I think it's primarily a gut issue that's driving everything else, which is often the case. But sometimes it's sort of obvious and we're not gaining that much information from the stool test or from whatever GI test we're getting. Sometimes there's something else that I have to look at. So it just depends. So first today, in lieu of what we started with yesterday. Oh, and I forgot to ask, did anybody get a chance to look at or have you heard of the ACE survey or test? That you can find links for it on the CDC website. You can find links for it. They have their own website. If you type in ACE in all caps, it's adverse childhood experiences. And when we talk about trauma and the gut, that's mostly what we're talking about. And some people may say, oh, I don't remember anything from childhood, or they may start their memories of childhood at a certain age. Like maybe they don't remember anything before the age of 5, or maybe they don't remember anything before the age of 6 or 7 or 8. Then you have to suspect that perhaps they had a negative experience or an adverse experience, and their brain and their memory are protecting them from re-experiencing it. But that's in the waking state, and usually in the sleeping state or in the unconscious state, they are still experiencing some of that trauma. So that can affect the digestive system, the nervous system. And really what I'm going to talk about today, I mentioned yesterday the psychoneuroimmunology. Sometimes you throw endocrinology in there too. Yeah, and trauma, yes, trauma can be generational. It can also be inherited, or what we call ancestral. So when that is the case, you really have to work with someone who does some type of energy work that they can clear those energy channel blocks. I'm trained in neuro-emotional technique. Another technique that's similar is emotion code. Another similar one is Psyche. And there are many others. And tapping can be effective, EMDR. So, and even if it's generational, a lot of those techniques can help with that and help clear that energy. So, and generational can go way, way back, before way back. So that can be a big factor. Yes. And it has layers. So trauma has layers. So with neuro-emotional technique, Bama Girl, you can find a listing on NET, capital NET, and then mindbody.com. And with Psyche, if you just search Psych, PSYCHE-K. If you search that on Google, you can find their website, and then they have clinicians listed. With the motion code, you can find the book, and you can learn the technique yourself. And there's a movie. If you search on your cable, I think it's on Gaia channel. It might be on Netflix. There's a 2-part movie that's on a motion code. So EMDR is mostly in trained psychologists or some type of trained therapist, like at least with a master's degree, usually for the EMDR. You can learn tapping online. There are also clinicians that will teach you tapping. So you can also search tapping online. There are different methods that are taught of tapping, so you can find that online too. So I was mentioning the ACE survey that we talked about yesterday, and you can look that up online, and you can do that yourself and then see how you score and see if you're at risk for possibly having an adverse childhood experience. And you can go back and look at the video from yesterday where I talked about that in more detail. So today I just wanted to go through a few studies that talked about this gut-brain link. And the first study was looking at autonomic nervous system regulation and the links to psychiatric problems and to gut dysfunction. So they found initially in animal studies, and then they found in human studies that there is a link. And actually, when I worked at the VA, we showed in a study that we did that there was a link between PTSD and autonomic nervous system issues. Autonomic nervous system is an automatic part of the nervous system. You've probably heard of sympathetic nervous system and parasympathetic. Parasympathetic is rest and digest. That's what it controls. You don't think about digesting when you're sleeping. So these are automatic functions that go on through the nervous system while you're sleeping, and you don't have to think about it. The sympathetic nervous system is a system that you utilize when you're running away from a threat, or if there's a threat, your heart rate's going to go up, your mouth is going to get dry, your breathing rate goes up, and your blood pressure goes up, and you start pulling blood sugar out of the liver so that you can run away from the bear or whatever the threat is. So that's what I'm talking about when I talk about the autonomic regulation and autonomic nervous system. So we found at the VA that it was tied to PTSD. When someone has PTSD, it causes the autonomic nervous system to be off kilter. And it's not something that just automatically gets back into its normal mode. It has to be trained into its normal mode. So if a person is symptomatic from the autonomic nervous system, you may have heard of POTS disease, especially with COVID. A lot of people are having problems with their autonomic nervous system. They may feel lightheaded when they sit up quickly. Their blood pressure may drop unexpectedly. They may start sweating profusely, looking like they're having a hot flash. And this can happen like at any time, especially if they get upset. We also at the VA were able to correlate PTSD with vestibular nervous system problems. So the vestibular nervous system is the middle ear system that controls, you have bones in there that are situated that give the brain messages about your position, like what position your head and your body are in. And when those bones are missituated, or if there's vibration or some other issue contributing to the message that's going from the middle ear to the brain, that can cause a person to feel dizzy. Their eyes you may see twitching back and forth. That's the vestibular nervous system. So we found there was a correlation between PTSD and trauma and disorders of the vestibular nervous system. I didn't mention also that sometimes people can have nausea and vomiting when they have derangements of that system. And also the autonomic regulation, when that's off, you can also have nausea and vomiting. And of course, you can have gut issues with all of that. So these are things that can kind of go together, and that conventional primary care doctors aren't really trained to look for those pairings or how that goes together. So if you've had some of these symptoms, you may not have been diagnosed at all. So then there was a paper that was in Developmental Psychobiology back in 2022. And the first author was Kolacz, Kolacz. And they looked at traumatic stress and autonomic brain-gut connection. And they also spoke about the polyvagal theory. Actually, this paper came out in 2019, in February of 2019. I misstated there. I said 2022. But this was looking at just basically the brain-gut connection and how the vagus nerve plays a role in that. I mentioned that it's like the superhighway for things traveling back and forth up from the brain and down to the GI system, and then up from the gut and the digestive system up to the brain. So more evidence. And some of the highlights of that study were that they saw connections of the packets of cytokines and chemicals, and the correlation with negative emotions and the inflammation of the gut-brain connection, the vagus nerve, and the digestive system. So they mention in the paper that there's tons and tons of data that's just accumulating now that shows, that suggests that enhanced peripheral levels of pro-inflammatory cytokines, or those chemical packets, and low cortisol. So cortisol is a stress hormone, and it can become low in people that have PTSD because they're chronically stressing that system and the system can't keep up. And they said that childhood trauma contributes to this pro-inflammatory state and the low cortisol in adulthood. And I can't tell you how many times I've seen the low cortisol and the kind of stressed out person with the gut issues. They just go together. Okay. So then lastly, I want to talk about in the Canadian Journal of Psychiatry in 2016, they looked at PTSD and they said, does the gut microbiome hold the key? So what they were looking at in this paper, they were looking at changes in the gut microbes in people that have PTSD. So I mentioned the low cortisol. When the hormones are not in balance, and cortisol is like the master hormone, and it comes from the adrenal gland. And when it's not in balance with the other hormones, we have 600 hormones and we have a bunch of neurotransmitters. So when these things are not in balance, It can be a two-way thing. So in the gut, the microbes that are in the gut, which we have hundreds of millions of them, or trillions, those gut microbes metabolize and make B vitamins, and they make short chain fatty acids. And the B vitamins are precursors to the neurotransmitters. So when you have someone that's stressed or chronically stressed, the microbes can be out of balance. The provitamins or vitamins can be out of balance, and that can throw all the neurotransmitters out of balance. And the hormones are generally out of balance because the cortisol is out of balance. And they all kind of feed into each other because one works off of the other. So it's not one simple correction that's going to correct this issue. It's multifactorial. And usually what I've seen is that people have toxicities, not only toxic emotions and negative emotions, but they have other toxicities like heavy metals. They may have a lot of yeast or mold. They may have other complicated situations like Lyme and Lyme co-infections. Now we have COVID-19 causing a disruption of the microbes in the gut too. So it can be a complicated situation. So we've covered a lot of ground today, and we have a few minutes, so I'm gonna open up for more questions. It looks like you all have had a few questions. And then tomorrow we're gonna talk about what we do to address these things and how I can help you through my programs and in my practice. So hopefully you can make it back tomorrow at the same time. Do you guys have any questions? You guys asked some great questions. And earlier, Dee was asking about generational trauma. That's been a big interest of mine, especially because in the diagnostic, we have a coding manual for coding diseases. And okay, good, Bama girl. We have a coding manual for coding diseases, and in those manuals, they have for generational stress, they have Jewish people listed because of the Holocaust, and they have Native American listed for their generational trauma. But interestingly enough, they don't have African Americans and post-slavery. That is not listed. So we hope that the psychiatric folks get that into the diagnostic manuals as soon as possible. I know psychiatric and mental health people that have been using those codes, yeah, have been using those codes even though they don't have the code, they don't have it listed for African Americans. Yeah, that is true. It's really crazy. Yet another disparity. We have disparities on top of disparities. So, yep. Okay. Oh, so Bama girl, you said meaning you as well as another practitioner. Oh, so you're asking about working with my practice. So I currently have a nutrition PhD candidate. So she's a doctoral candidate in nutrition that's working with me in my practice right now. So yeah, people that come in right now get that benefit of working with her. She has 15 years of experience as a registered dietitian, but she's been studying with us for me and Dr. Sanza, because Dr. Sanza and I partner together with a weight loss program that we created a few months ago. And that one is called BU to the Fullness. We just started our second cohort. So the next cohort for that will probably start in, let's see, this April, May, June, probably like July will be the next cohort. But the BU to the Fullness program is unique because we're addressing disparaged populations. First of all, it's mostly women. It's designed for women. We gamified it with a couple of, oh, okay. Yeah, so you know about the program. Yeah. So yeah. So you probably met the nutritionist that's rotating with me right now, if you're in the program. Great. So Bama girl, were you born in Alabama? I think I recognize your picture, but I'm not sure. Thought you looked familiar. Okay. I was born in Montgomery, and I have family, both sides of the family from Alabama. Okay, from Mobile. Very good. All right. So we have the last meeting tomorrow for the current cohort for the BU2 Fullness program. So, all right. I hope you can make it then. So, oh, okay. All right. Great to see you here. Great to see you here. So, I hope you'll be able to make it tomorrow because Dr. Ellen's going to be speaking tomorrow. She's going to be hitting the nutrition topics tomorrow, so that should be good. Things like eating out, the basic elements of the Mediterranean, which is what we teach. So yeah, so do you all have any other questions for today? Okay, great. I hope to see you there. I'll be there after this tomorrow. I'll be doing this and then jumping right over to the other one. All right. All righty. So if no one has any further questions, you guys asked some great questions today. Great questions. Today was a lot of science information. I tried to make it as simple as possible, but this is like some recent science information that's coming out. So all this gut brain stuff is kind of new. Even my colleagues that are in conventional medicine, they're trying to figure out what it means because it's really new to them. At least us in integrative and functional medicine, we've been talking about this for years, at least 10 years. But the conventional folks are starting to read about it. Of course, they're not doing anything differently in their practice yet, but they're starting to read about it. So that's great. All right. Well, you guys have a great evening. Thanks for joining me. And hopefully I'll see you tomorrow. All right.